Thank you for the invitation. I'm really delighted to be able to speak about this topic. We've been evaluating the Healthy Start scheme. It's been a piece of work that was commissioned by the Department of Health and Social Care to really have a look at how Healthy Start is being rolled out and why the uptake rates are a bit lower than expected in England. So just to say that this work is obviously focused just on England. We don't look at Wales or Scotland or Northern Ireland. So this evaluation, the scope is within England. So just to move on, I just wanted to sort of highlight initially that the Centre for Food Policy and really just describe that our work aims to inform policy and practice so that we can transform our food system to be healthy, sustainable, equitable, and resilient. And really, we do that through a range of different avenues, generating evidence, providing spaces for debate like webinars and our annual symposium, and that ultimately we aim to inform policy and practice, and that we see education as a key part of informing policy and practice to have the next generation of food policy shakers out there. So this work really forms part of the generating evidence and the policy and impact piece. But just to highlight that lived experience is a really key component of our research. And this work that I'll be presenting today really does focus on the lived experience of stakeholders across the Healthy Start scheme system so that we could really get an understanding of what's happening in practice and identify some recommendations that would allow the Healthy Start scheme to be more effective for more families. So this will not be news to anyone, and if anything, this is slightly a bit old, but the data is still pretty current in terms of the statistics haven't changed that much. But there's a large number of families that are still experiencing food insecurity in the UK. It's just around 20%, it's become just below 20% of households with children experience food insecurity. And actually, that number is even higher for families with children under the age of 5. So we know that families who are eligible for this Healthy Start scheme really do need this because they actually are not able to afford fruit and vegetables, fish and dairy and eggs. And this is some great data, again, I said it's from last year, that really shows that the healthier products are being consumed less in households that are food insecure compared to those that do not experience food insecurity. So you can see significantly higher rates of not consuming fruit and vegetables, fish, dairy, and eggs. So there really is a need out there. So what is the Healthy Start scheme? Now, this will not be news to many of you on the call, but just to ensure that we've all have the same basis level, I just wanted to highlight and sort of describe the scheme. So the scheme is it is a financial incentive or financial contribution to support families to feed their children well, and it also comes with vitamins, so free vitamins. The scheme starts from 10 weeks of pregnancy, and the financial component offers £4.25 for each child that is in the household that is under the age of 4. As I said, so that is appropriate for a pregnant woman, and the vitamins are available for every child as well. So this scheme doesn't have the 2-child cap like some other benefits. It is available for every children. In recognition that formula-fed children need a little bit of extra money, there's a top up, if you like, for children from birth to 1 year within the scheme. So any child who is registered on the scheme who is between birth and 1 year of age get double the amount of money. So they get £850. As I said, it goes from up until the 4 years of age, and the vitamins are available both for mothers and children. The mothers during pregnancy and the vitamins for children. So they're little drops, and they make a really important difference. But there's lots of challenges around accessing the vitamins. This is a really important contribution. So for many of us who do not experience food insecurity, £4.25 per week doesn't seem like a lot of money. But for families who are experiencing low income, really that additional supplement makes a huge difference to their household food budget. So we've had people who say, do you know what, I've got £50 food budget for a week, and this makes such a huge difference. You know, to have these £18 is such a significant contribution to my £50 a month food budget. Over the course of a child's life, it's worth around £1,200. So again, quite a significant amount of money over that course of time. But as we know, uptake rates are very low. So as I said, the focus of this evaluation was on England. Now, there's been a glitch in the data in terms of being able to access uptake rates, which will not be news to anyone. But the last data that we have is from January 2023. And at that time, uptake rates were 65% across England. So we knew that there were over 175,000 people that were missing out on being able to access this scheme. And really, with it making such an important contribution to families' lives, we really wanted to find out why this wasn't working. So we had two key research questions that we explored during this research. First was, what were families' and stakeholders' perceptions and experiences of the Healthy Start scheme in England? And then the second one was, what are the recommendations that people have for improving the scheme? We took a range of different methods. So we used a method that's called rapid qualitative analysis. And the reason that we conducted this is twofold. One is it allows you to speak to a large number of stakeholders from across the system. And we were really interested in taking that systems approach. We didn't just want to hear from families, we wanted to hear from retailers and housing officers and midwives, so a whole range of the system. And really what rapid qualitative analysis allows you to do is to use sort of very robust analysis methods, but is an in-depth thematic analysis. So you're looking for that high level findings and themes that come from across a wide range of people. We coupled this with some work with ActiveMob, and ActiveMob are a social enterprise, and they spoke to a lot of families in a really informal way. So they had ethical approval, but they didn't come with recorders, and they didn't come in sort of the more intimidating traditional research approach. And that we found really, really effective. And they went to these places twice. We had 3 case study areas that you can see here on the map, located in blue. So Manchester, Redbridge Borough in London, and Southampton. And the reason that we chose these 3 locations was because they had different uptake rates, they're regionally diverse, and there's also great ethnic diversity amongst them as well. We did include some other sites of interest where the uptake rates had been really increased over time. So we were really interested in what they'd done and how we might be able to learn from that to translate into our recommendations. So we spoke to 112 people. You can see the breakdown of participants here on the slide. Lots of families, which was excellent to get that really diverse range of families who have been eligible and might choose not to use the scheme, or those that are eligible and using the scheme. We spoke to local authority staff, health professionals, advocacy organisations and non-government organisations, and retailers. And you can see we did both a national sort of representation as well as local in-depth in our case study areas. So what did we find? Well, we had a range of key themes, and I'm just going to talk through those now. The first key theme that was very clear across all stakeholder groups was that Healthy Start is wanted and it is needed, especially in the cost of living crisis. People have really felt that pinch. There's also a sense that the payment card is better than the vouchers. There's less stigma associated with it. It's much easier to use. If you can use it in a wider range of retail outlets, and it causes families a lot less anxiety. So that shift to digital was really great. Healthy Start changes the way families eat. So yes, people really did say, my child's diet has improved as a direct result of this because I can afford to buy those fruit and vegetables that I couldn't buy in the past. But there were a few issues with the scheme that families also highlighted, which again won't be new to anyone, but that gap between the scheme ending at 4 years when a child turns 4 to when a child starts school and is eligible for free school meals is a massive pinch on a family's household budget. So that gap is really tough for many families, and they find that a real struggle. So there's something around that recommendation of extending the eligibility so there's no gap in that nutritional safety net. Also, there was a real sense that the value wasn't enough. So while I highlighted earlier that it's really important contribution it does make to a family's food budget, it's still not enough, and it's not kept up with inflation. The second one was, it's not just about raising awareness. So while raising awareness is an important component, so more people know about the scheme, there's other barriers that get in the way of people joining the scheme. So these were really sort of grouped into a fear of authority or consequences from the scheme. So there was a lot of misinformation, particularly in some communities, that they might let them to lose other benefits, or that they might have to pay it back if they were inappropriately assigned the Healthy Start scheme. There was also this perception amongst some families and some groups of communities that it's not for me, that actually our culture doesn't believe this, or it's not accepted by my neighbours, and therefore actually I shouldn't be having it. There was also a feeling of stigma around it being framed as a benefit. And actually there's real credit in it not being framed as a benefit, but as a nutritional safety net and a right for children to be fed well. And the final one was around families needing help to apply. So families want to keep control of that application process, and it moving to an online form has really helped, but there's still a lot of information that is being asked, and people like to have a professional or a friend or someone next to them to really help them fill that out. It wasn't always clear who can apply, so there's lots of questions and confusion around the eligibility criteria because it is complex. It's not necessarily just a clear cutoff. We wish it would change to something like the new free school meals criteria that has just been introduced, where it's anyone on universal credit. But at the moment, with the legacy benefits, there's a huge amount of complexity. And that's very hard for professionals and volunteers on the ground wanting to support families to even be able to judge whether families are eligible for it. The system was also very unfair for vulnerable groups, particularly those with no recourse to public funds. So the children who can apply, they have to use a specific form, and they require a lot of information. And it's the same for teenage mums. They also need to have a paper form, and it's done on a case-by-case basis, and that's really hard. It's sort of another barrier for these already families that already experience a lot of barriers in their daily lives. The other sense was, of course, that Healthy Start should be auto enrolment and make it an opt-out scheme. That we heard a lot, and it would make it a lot easier on families and communities on the ground. The second is really that there was this sense of a disconnection of services, both at local and national levels. So if I'm going to jump to the second one, government departments are not joined up. Now, unfortunately, that has happened a bit around the data. We've kind of seen that in black and white, where DWP and DHSC systems are not aligned. There's a lot of work that's going in to make this and correct that. But really a recognition that some government departments, to make the scheme work effectively, need that system to be joined up. But on the ground, families also felt that systems weren't joined up and that there was no one to talk to, particularly post-COVID. Citizens Advice Bureau used to really support families, and now it's a phone and it's very faceless, and I get someone different every time. And they just wanted someone to talk to, and talked and reminisced a lot about Sure Start Children's Centres and how effective they were, that there was a connection that you could build up. There was also this sense that there were many missed opportunities to sign families up to Healthy Start. Why can't the job centre use universal credit? Or why can't the numbers like we get for the under twos to sign people up? Why can't those data be shared in a much more eligible way, so that it's easier for professionals and voluntary organisations on the ground to support people in signing up? Then the last two were around this lack of capacity and resources. Of course, this isn't new, but there was a real sense that workforces had been depleted, particularly midwives and health visitors, that core workforce had been depleted a lot over COVID. And there was this sense that a Healthy Start should be part of everybody's job, but actually it's not linked to people's KPIs, and that sense of responsibility almost slipped through the gaps. And part of that was because there wasn't resources and capacity, but part of that is because there wasn't stronger leadership and accountability, both on the ground and at a national level. And that when you've got limited resources, there are conflicting priorities that just get in the middle. And how important is Healthy Start when it might only reach several hundred people in our community, versus another problem that you know, there's several thousand families who are experiencing that problem. So there's this issue. But what we've really heard is that stronger leadership and accountability really are needed for Healthy Start at the local level. There's a misconception and confusion about whether that sits with children's services, whether it sits with public health, whether it sits with the voluntary sector, and that sort of lack of leadership means that there's a lack of accountability, which means that monitoring of uptake rates and that coordinated action then often slips through the gaps. So finally, I really just wanted to pull together then the recommendations that came out of this research, and this really did come from the data. So there were 7 key recommendations that came out. First of all, to continue to offer Healthy Start and to assess how much the current value by so that it increases with inflation, to have sort of this close cross-departmental Healthy Start working group that would tease through some of these issues and make sure that it went smoothly for people around eligibility criteria, so there wasn't the gap for 4-year-olds, so the data were available. But also, so point 3 and point 3 and point 4, we are really working a bit more on is what language can we use for Healthy Start to really make sure that it's acceptable for everybody, that there isn't that sense of stigma. We also needed some promotional leadership on promotions, but ensuring that there's enough capacity for people to get that helping hand. There was a requirement for stronger coordination and communication between national, regional and local levels, and coordinated local action so that there was leadership. So we're currently exploring whether making it a requirement of health and wellbeing boards to report against Healthy Start might be possible and feasible as a way of delivering that local leadership and accountability. And then finally, there is a real sense to develop one-stop shops to support families holistically, going back to that family hub and that Sure Start sort of centre where people feel connected and feel like they can raise really important issues for them. So this is just to highlight this work has been published. Here's the publication in BMC Medicine, and to acknowledge my colleagues, Millie Barrett and Mark Spires, who contributed to this work.